Here is your question. Right. So if you have read and understood, considering it clinical anatomy station, surgical anatomy station, kindly tell me if you can identify. Yes, what region are you looking at?
Looking at gluteal region.
Okay.
Both, including both hip joints.
Yes, and dissected deep, showing you what? Can you
Deep, showing the.
if you begin from the left hand side, if you can, these are the marked structures. If you can identify this one, what is this?
This is iliac crest.
Below that, which muscle could that be? This one?
Below that, gluteus minimus.
Okay. Which muscle is that?
This is gluteus maximus.
Can you tell me the arrangement, origin and insertion of this muscle and the nerve supply, please?
Gluteus minimus originates from
No,
the
this
outer surface of
maximus.
iliac maximus. Okay, originates from the outer surface of ilium, in between the posterior and inferior to the inferior gluteal line, with posterior surface of sacrum
Yes.
and coccyx and
Yes.
iliac tract, and
What is the nerve?
inserts
Yes.
for
Yes, please.
nerve
Sorry.
supply is inferior gluteal nerve.
Okay, good. Right. If you can identify which muscle could this be? Below? Would you be
Ma'am,
able
these
to
are hamstring muscles.
Okay, very good. If you can come on the right hand side, and if you can please identify this muscle.
This is gluteus medius.
This is minimus. This is medius. Okay, in this image. Because this is,
Yes.
if you look at the distribution, how is it distributed?
It
How
is
is it
between
present? Yes.
between the anterior gluteal line and posterior gluteal line.
Can you please identify this muscle over here? And what is
This
the
is the
clinical?
piriformis.
Very good. And what is the clinical significance of this muscle?
Significance, it stabilizes hip joint and causes flexion of hip joint
and
external rotator of hip joint.
yes, and does it form any boundaries, structures
yes,
above
yes,
or
ma'am.
below? So please tell me that.
Yes,
Please,
ma'am.
please.
Greater sciatic notch. It comes through the greater sciatic notch, and some structures pass above it, and some are below.
So it's an important landmark. Yes.
Yes.
As compare when you are comparing with piriformis muscle, sciatic nerves, how is it related?
Passes below the piriformis.
Passes below the piriformis. Okay. Can you please identify, if you could see in this image, quadratus femoris muscle, and which one would that be? Because after this is piriformis, and there is 1, 2, 3, and 4 structures pointed. Which one of them is quadratus femoris, please?
Ma'am, I cannot see the 1, 2, 3 markings, but
Okay, I'll point again. 1, 2, 3, and this is 4. Because this is piriformis. So which one of this is?
Yes, number one is the quadratus femoris.
No, it's the last one. Okay, can you please tell me the origin, insertion, nerve supply, and action of quadratus femoris muscle?
Quadratus femoris originates from the outer surface of
Yes, of
uh,
upper part of the ischial tuberosity, and then insert
ischial tuberosity and inserts in the quadratus tubercle of just behind the
of the femur.
greater trochanter.
And its nerve supply is
Its nerve supply nerve to the quadratus femoris
femoris, yes.
comes from the sacral plexus,
And it's one of the lateral rotator of the thigh.
external rotator. Yes.
Okay, right. Can you please tell me if you can, how the hip joint is formed, if you can explain that to me, please. Since we are
Hip joint
dealing
is
with
formed.
the, yes,
Hip
yes,
joint is formed by the femoral head and acetabulum, along with its capsule and surrounding ligaments and muscles.
okay. Can you name those muscles and ligaments?
Ligaments are
Okay, we'll come back to that later. Right, you can please, this is which bone you're looking at? One of the bone which is?
this is the right
One of the bone which
femur,
is used, yes, in the formation of hip joint.
left femur. Ma'am.
Okay, good. Can you please identify this? On the left-hand side,
Number 3,
image
femoral head.
3. 3 is femoral head. Can you tell me the
Femoral
nerve
head.
supply of the femoral head, please?
Nerve supply
Blood supply.
comes from femoral
Blood supply.
blood supply. Okay.
Yes, it was a slip of
Comes
tongue.
from
Blood supply.
retinacular vessels,
Yes.
mainly contributed by medial and lateral circumflex humeral vessels, and smaller contribution from superior and inferior gluteal vessels,
Yes.
and along with artery of the round ligament of femoral
How
head.
the blood
Comes from
supply,
the obturator vessel.
yes. How the blood supply differ from adults to compared to children? Blood supply of the
In
head
case
of
of
the femur.
children, the
Yes.
main supply the main supply comes from the artery of the round ligament of the ligament of femoral head.
Yes.
And in case of adult, this supply becomes minor supply from this source,
Yes.
and the retinacular vessel becomes the major supply.
Okay. Can you please identify in the image A here, this structure 5?
Structure 5, linear.
Okay. 4, please.
4 is the
Where is my cursor? 4, please. Here. Okay. If you can identify this 5, is this 5 and this 5 are they the same?
Yes, ma'am. Laser trochanter.
Okay. 11, please.
Yeah, 11 is the trochanteric fossa.
Okay. If we are moving on the right hand side, if you can identify 12.
12
With
is
my
the
cursor? Yes.
greater trochanter.
Okay. If you can please tell me how many hamstring muscles are there?
There are 3 hamstring muscles: semimembranosus, semitendinosus, and biceps femoris.
Okay. When you have to consider biceps femoris, how many heads this muscle has?
There are 2 heads: long head and straight head, and long head and
Short head. Okay. Can you
short.
please tell me the blood nerve supply of biceps femoris?
Biceps femoris, the short head supplied by common peroneal nerve, and the long head supplied by tibial nerve.
Yes. Okay. What is the action of this muscle?
Biceps femoris causes flexion of the knee joint and
Very good.
extension of thigh.
And helps in lateral rotation of the knee as well. Okay.
Excellent.
Right. Okay. If you can tell me the functions of semitendinosus and semimembranosus as well, please.
Semimembranosus, semitendinosus,
Their
along with
function.
the hamstring group of muscle,
Yes.
causes the same function, knee flexion
Knee
and
flexion. Very
thigh
good.
extension.
Very good. Very good. Okay, good.
And semimembranosus has another function of medial rotation of knee joint.
Very good. Good. Thank you.